Did you know that every 23 seconds, someone in the world is diagnosed with diabetes? It's a silent epidemic affecting hundreds of millions. But what if I told you that for many, it's not a life sentence? What if the key to managing or even reversing this condition was simpler than you think? Stay tuned, because by the end of this video, you'll understand diabetes in a way you never have before and discover actionable steps to reclaim your health. So let's start with the basics. What exactly is diabetes? Imagine your body is like a car, and the food you eat, especially carbohydrates, is the fuel. This fuel gets broken down into a type of sugar called glucose, which enters your bloodstream. Now, for your car's engine, your body's cells, to use this fuel, you need a key. That key is a hormone called insulin, which is produced by your pancreas. Insulin unlocks your cells, allowing glucose to enter and provide energy. In a healthy person, this process works seamlessly. But in someone with diabetes, there's a problem with the key. There are primarily two types of this problem. Type 1 diabetes, which is an autoimmune condition. The body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. It's like losing your car keys entirely. Without insulin, glucose can't get into the cells, so it builds up in the bloodstream, leading to high blood sugar. This type often develops in childhood or young adulthood and requires lifelong insulin therapy. Then there's type 2 diabetes, which is far more common, accounting for about 90% of all cases. In this scenario, it's not that the keys are gone. It's more like the locks on the car doors have become rusty and difficult to open. Your pancreas still produces insulin, but your cells become resistant to it. They don't respond properly. To compensate, your pancreas works overtime, pumping out more and more insulin to try and force the glucose into the cells. Eventually, the pancreas can get exhausted and may not be able to keep up, causing blood sugar levels to rise dangerously. This resistance is often linked to lifestyle factors like diet, physical inactivity, and excess body weight, particularly fat around the abdomen. So why is this a big deal? Well, when sugar hangs around in your blood instead of being used for energy, it acts like a slow-acting poison. Over time, high blood sugar can damage nerves, blood vessels, and organs throughout your body. It dramatically increases the risk of heart disease, stroke, kidney failure, blindness, and even amputations. It's not just about managing sugar. It's about protecting your entire body from a cascade of devastating complications. Now for the good news. While type 1 diabetes requires careful medical management, type 2 diabetes, which affects the vast majority of people, is often highly manageable and in many cases can even be put into remission. It's about giving your body the right tools to fix that rusty lock problem. It starts with simple, powerful lifestyle changes. First and foremost, let's talk about food. The single most impactful change you can make is to reduce your intake of sugar and refined carbohydrates. Think of things like sugary drinks, white bread, pasta, pastries, and processed snacks. These foods cause a rapid spike in blood sugar, forcing your overworked pancreas to go into overdrive. Instead, focus on a whole foods diet. Fill your plate with non-starchy vegetables like broccoli, spinach, and bell peppers. These are low in carbs and packed with fiber, which helps slow down sugar absorption. Incorporate healthy fats from sources like avocados, nuts, seeds, and olive oil. These fats are not only good for your heart, but also help you feel full and satisfied, reducing cravings for unhealthy foods. And don't forget protein. Lean protein from sources like chicken, fish, beans, and lentils is crucial for building muscle and maintaining a stable metabolism without drastically spiking your blood sugar. A simple rule is to make half your plate vegetables, a quarter protein, and a quarter a high-fiber carbohydrate like quinoa or sweet potato. Next, get moving. You don't have to become a marathon runner overnight. The goal of exercise is to make your cells more sensitive to insulin, essentially, to oil the rusty locks. Just 30 minutes of moderate activity, like a brisk walk, most days of the week can make a huge difference. When you exercise, your muscles use glucose for energy, which helps lower your blood sugar levels naturally. Find an activity you enjoy, whether it's dancing, swimming, cycling, or gardening. Consistency is far more important than intensity. Finally, managing stress and getting enough sleep are non-negotiable. Chronic stress releases hormones like cortisol, which can raise blood sugar levels. Practices like meditation, deep breathing, or yoga can be incredibly effective. Similarly, Poor sleep disrupts the hormones that regulate appetite and blood sugar. Aim for 7 to 9 hours of quality sleep per night to allow your body to rest and regulate itself properly. By combining these strategies, cleaning up your diet, moving your body, and managing stress, you are not just treating symptoms. You are addressing the root cause of insulin resistance. You are giving your body a chance to heal itself. It's a journey, not a sprint. But every healthy meal, every walk, and every restful night asleep is a powerful step toward getting rid of the grip of diabetes and taking back control of your life. The power to change is in your hands.